The AAST grading system for splenic injury. Understanding splenic trauma in modern medicine. Welcome to our channel, where today we are delving into the details of the American Association for the Surgery of Trauma grading system for splenic injury. This standardized system has become the cornerstone for communication among trauma surgeons, radiologists, and other healthcare professionals, guiding essential decisions in the management of splenic trauma. Let us begin with the purpose and foundation of this grading system. The American Association for the Surgery of Trauma Organ Injury Scale is designed to classify the severity of traumatic injuries to solid organs, with a special focus on the spleen. Its objectives are clear: to ensure consistent terminology for clinicians, to direct clinical management decisions, to inform patient prognosis, and to provide a framework for research and comparison of patient outcomes. The grading system spans from Grade 1, indicating the least severe injury, to Grade 5, which marks the most serious form of splenic trauma. There is also a Grade 6, which is reserved for situations where the spleen has been completely detached, a condition referred to as avulsion. In the most recent update to this scale, published in the year 2018, the emphasis has shifted towards the identification and importance of vascular injuries. These are detected through advanced imaging techniques, such as computed tomography scans, and are characterized by findings like contrast blush, pseudoaneurysm, and arteriovenous fistula. The severity grade is determined by the deepest injury present at the time of assessment. Let us walk through each grade to provide clarity. Grade 1 injuries are characterized by a small, thin hematoma beneath the capsule, covering less than 10% of the spleen's surface area. Alternatively, a Grade 1 laceration involves only a superficial tear to the capsule or a shallow cut into the parenchyma. Moving up to Grade 2, the hematoma expands to between 10 and 50% of the surface area or is found within the parenchyma, measuring less than 5 cm in diameter. Grade 2 lacerations are deeper, ranging from 1 to 3 cm, but do not involve the main blood vessels within the spleen. Grade 3 injuries present either a very large subcapsular hematoma, occupying more than 50% of the surface or expanding rapidly, or a ruptured hematoma. At this grade, any laceration deeper than 3 cm is also included, and these injuries may begin to affect the internal blood vessels of the spleen. Grade 4 marks a significant step up in severity, as lacerations now involve either the segmental or main hilar vessels, leading to more than a quarter of the spleen losing its blood supply. In imaging studies, this appears as a focal area that does not enhance with contrast, signaling the loss of circulation. Grade 5 encompasses cases where the spleen is shattered into multiple fragments or when there is an injury to the hilar blood vessels causing complete devascularization. Imaging will show that the organ does not enhance at all, and active bleeding is seen as a persistent area of contrast extravasation. Finally, Grade 6 is reserved for the most extreme scenario: complete avulsion. This means the spleen is entirely torn away from its vascular connection, a situation most often discovered during surgery due to its critical nature. It is important to note that if a patient suffers multiple injuries within the spleen, the grade should be advanced to reflect the cumulative severity. Now, let us discuss some key concepts and their clinical implications. The most recent revision to the grading system draws special attention to vascular injuries, particularly those that manifest as a contrast blush on imaging. The presence of such a finding automatically elevates the injury to at least Grade 4, regardless of the size of any hematoma or laceration. This is crucial because vascular injuries are strong predictors of ongoing bleeding and the potential failure of non-operative management. Speaking of management, the approach varies by grade. For Grade 1 and Grade 2 injuries, the success rate for non-operative management is exceptionally high, with most patients simply being monitored in the hospital. Grade 3 injuries have a good prognosis with conservative treatment but require closer observation, especially if there is any evidence of vascular injury. Grades 4 and 5 are associated with a much higher rate of unsuccessful non-operative management. Intervention, such as angioembolization, a minimally invasive technique to block bleeding vessels, is often necessary. This advancement allows many patients to avoid surgery even at these higher grades. Nevertheless, surgical intervention remains essential for unstable patients or those who do not respond to less invasive treatments. A phenomenon known as talk and die is well documented in splenic trauma. Patients may initially appear stable, able to communicate and interact, but can deteriorate rapidly if compensatory mechanisms fail. This underscores the importance of intensive monitoring for those with high-grade injuries. It is crucial to remember that while grading provides guidance, it is not the sole determinant of management. The physiological status of the patient, their clinical stability, remains the most decisive factor. A stable individual with a severe grade 5 injury may benefit from minimally invasive treatment, while an unstable patient with a milder injury may require immediate surgery to save their life. In summary, the American Association for the Surgery of Trauma grading system offers a vital, standardized framework for the assessment and management of splenic trauma. The 2018 revision rightly highlights the significance of vascular injuries and patient stability in guiding treatment decisions. Thanks to advances in imaging and interventional techniques, spleen-preserving strategies have become the norm whenever clinically appropriate, reflecting a profound evolution in trauma care. Thank you for joining us for this deep dive into the grading of splenic injuries. Stay tuned for more educational episodes on trauma medicine and other critical topics. Do not forget to like, subscribe, and share this podcast if you found it informative. It's the Everything Surgery Podcast. Dissect the extraordinary.